Hey everyone, I'm Pratik, a dentist and a specialty doctor. And in this video, we're going to be looking at various ways of managing anxious dental patients. If you want to see similar educational content to this, make sure to subscribe to the channel. Within my day-to-day job, I carry out intravenous sedation, and I deal with lots of anxious patients. Through this experience, I've picked up lots of general hints and tips that I can then apply to my work in practice to help manage anxious patients more effectively. And dental anxiety is extremely common. It is fed through various ways, which we'll look at in this video. Now, there are many ways of managing an anxious patient. These include pharmacological methods, but in this video, I'm going to go through some relatively easy changes that you can make within your day-to-day practice to help manage patients chairside. I must emphasize that this video isn't a comprehensive list of anxiety management methods. However, it's looking at some very simple things that you can start implementing in day-to-day work. Dental anxiety and anxiety in general stems from a variety of causes. It may be that a patient has had a past experience that's affected their feelings towards dental treatment. It could be that the patient has heard stories from other people. So for example, a lot of children are quite anxious, and it may be because their parents have told them horror stories about going to the dentist. But effective management of an anxious patient is so important. If you poorly manage an anxious patient, you could end up strengthening or reinforcing their existing anxiety. And this isn't something that we want to do, because then it may reduce their ability to attend for dental treatment and reduce their access to dental care, which ultimately is going to affect their general health. In contrast, if you effectively and appropriately manage an anxious patient, you may end up reducing their anxiety, and they may feel far more comfortable coming to the dentist. The added difficulty is that anxious patients don't often present to a dentist until they have a problem, and often when they do present, it's usually with symptoms that require quite invasive treatment, and so it becomes a bit of a vicious circle and their anxiety gets strengthened. So let's start looking through some of the ways we can manage anxiety. One of the big sources of anxiety for patients is the fear of the unknown when they go to a dentist, and that loss of control that they have. And a big way of managing this is building trust with a patient. Trust can be built in several ways. It can be built in your general management of the patient, how you communicate with them. You can also do simple things by providing written or verbal information of what is going to be done at appointment before the appointment happens. So for example, if a patient's coming for a checkup and they need a filling doing, providing them with the information about that filling at the checkup appointment rather than surprising them with it at the actual treatment appointment. This then means the patient can go home, they can digest the information, they can ask you questions, and they can come to the next appointment more prepared. Another really big way that you can gain trust from a patient and give them some control back is basic stop signals. So I commonly will tell my patients, even before I start doing anything, that if they have any problems, or if they just want to break or they want to ask a question, just to pop their hand up, and immediately I will stop what I'm doing. I also reinforce this as I'm going through the procedure, because this constantly tells the patient, constantly reminds the patient that they actually have some control in what is happening. Another big aspect to managing an anxious patient is acknowledging and understanding their anxiety, so being empathetic. It's really important that you develop your chairside manner so that you spend time to speak to the patient, to listen to their anxiety, and to try and understand it a bit better. In this simple act, you also go back and you build trust and rapport with the patient, because the patient thinks that you care about them and you care about their anxiety. Another thing that I personally like to do is when a patient is anxious, I like to ask them what is their source of anxiety and what makes them anxious at the dentist. This does two things. The first one is that it shows the patient that I care about their anxiety and I'm acknowledging their anxiety. But the second thing that it does is it gives me information about their anxiety that may provide me with some direction that we can go to help manage their anxiety and reduce it for them. So for example, in the hospital, I commonly get referrals of anxious patients. And when I ask them what they're anxious about, a lot of them say that they're scared of pain. And so what I do in response to this is I try and reassure them that I don't want them to be in pain, and that once I give the anesthetic, I always check and triple check that the anesthetic has worked. If it hasn't, they can tell me, i.e. they have got control over what is happening. And through this method, a lot of this anxiety about a fear of pain is removed. As well as acknowledging the anxiety, it's important to provide reassurance to an anxious patient. So when patients are referred to the hospital, for example, a lot of them, I will tell them that I do this day in, day out, or I tell them that we have anxious patients all the time coming through the hospital, and therefore we're very good at managing them. All of these things reassure the patient, and it helps build a bit more trust in what we're doing. Again, linking back to the control and providing reassurance, always remind the patient they can ask you a question at any time. This will help reassure them that if they do have concerns concerns, if they're worried about something, they can raise it with you. In terms of when you're communicating with the patient, just general body language is really important. Having a good, friendly manner, facing the patient, making eye contact, all of these are really important because the patient feels you're engaging with them and you're understanding their concerns. Now to just touch on some very simple techniques that we can use to try and help manage anxiety. Distraction is a very common way. When patients are having anesthetic, sometimes I will tell them to wiggle their toes or listen to the music or have a TV on. All of these will help distract the patient from what is happening. Even while giving anesthetic, sometimes if you can move a patient's lip whilst you're doing the anesthetic, that will distract them from what you're doing. Another very common technique used with children is the tell, show, do technique. So this is where you would tell the child what you're doing. You will then show them. So for example, if you're going to do a fissure sealant on a child, you might put some acid etch on the glove, you might then paint on some sealant, and this will just show them the materials that you're going to use, the equipment that you're going to use. This goes back to the idea of the fear of the unknown. By showing them what you're going to do, you can hopefully reduce this fear. Leading on from this, modeling is also another technique, more commonly used with children, but can be used with adults as well. And this is essentially where you carry out a procedure on someone else who the patient knows. So for example, it may be their brother, their sister, and they are able to observe exactly what is happening. And this again may reassure them that actually there's nothing to worry about. Desensitization is another important technique. And this is where we gradually expose a patient to aspects of the dental surgery or the dental practice. And by gradual exposure, the patient ideally should become more and more comfortable being in that environment. And this desensitization is of varying degrees. So it could be as simple as the patient just coming in, so for example with children, and just sitting in the dental chair in one appointment, and that's enough. The following appointment could just be they sit in the chair and they open their mouth, and you gradually build them up by doing this. Finally, some very simple things that you can consider for work. First one is, with anxious patients, identifying them and then sticking to time, keeping to time in your diary. If you feel that this is going to be quite difficult if a patient is in the middle of the day, try scheduling an anxious patient first thing in the morning or first thing in the afternoon. And this means they're not waiting around, they're not waiting for their anxiety to build. It's also really important to have a calming environment. So soft colours, soft music within the surgery, making sure you work well with your nurse so that you both have calming, soothing tones. In some situations, your patient may feel more comfortable talking to the nurse about certain things rather than the dentist because their fear comes from the dentist. If this is the case, work with that and allow your nurse to engage in what's happening. It's also nice to have pleasant smells, calming lights. So for example, when I carry out intravenous sedation, I'll often turn off all the ceiling lights and just have the dental light on. This darkens the environment, it makes it far more comfortable for a patient. And then we usually have some light acoustic music in the background, and that eases the patient down even more. We've looked at lots of techniques that you can use to help manage anxious patients more effectively. I think the biggest takeaways are that you need to address the patient's anxiety. So don't hide away from it, acknowledge it, discuss it with them, and then find what works best for them. By managing an anxious patient properly, we can entirely change their perception of dentistry. So it's really important that we spend time on these patients. If you found this video useful, please make sure to like, comment, and subscribe. And until the next video, take care.